12:01. So in the interest of time, I am going to go ahead and get started. I want to thank all of you who have dropped in for the webinar today. This is the Ask the Expert seminar series that we co-host, three of us, two CU universities, venture partners at Boulder and the CCTSI and the Spark Reach program at CU Anschutz, as well as CSU Ventures, the Tech Transfer Office for Colorado State University. We co-host this and put it together for all three of the campuses. So thank you for joining us today for our wonderful presentation with Dr. Jo Viney, who is on this morning as well. Let me just check and see. We are up to just over 20 participants. So that you all know, I am Sarah Hibbship. I am the Managing Director of Communications for the Colorado State University Research Foundation. I manage communications for our tech transfer unit that serves the entire CSU system. And I am so pleased to be interviewing Jo today and carrying on this lovely conversation. So that you all know a little bit more about Dr. Viney. I believe it was 2020, she was chosen as one of Fierce Pharma's fiercest women in the life sciences. And so we are incredibly happy to have her here today. She started her journey with a PhD from St. Bartholomew's Hospital in London, and went on to serve a couple postdocs at the Imperial Cancer Research Fund, which is now Cancer Research UK, as well as Genentech, and then has moved on in various roles to Immunex, which was purchased by Amgen, and then headed immunology and drug discovery programs for Biogen. In 2017, Jo stepped out of that world and co-founded Pandion Therapeutics, which is a small company focused on autoimmune disease therapies. And in just over 3 years since co-founding that, Pandion has raised its Series A and B and completed an IPO while swelling its headcount to more than 60. And this past year, I believe, was fully acquired by Merck. And so talk about a successful exit strategy, if that's what you were going for. So we are so pleased to have you here today, Jo. And for everyone who's on the webinar right now, the Q&A is open. And while I do have a wonderful list of questions to ask Jo, should any of your own questions you wish to put those in the Q&A, we will do our best to get them answered as we move through the next 55 minutes. So to start, Jo, again, welcome and thank you for joining us today. And I gave a very brief intro to you. So if you would like to expand on that and tell us a little bit more about your journey, that would be wonderful.
Yeah, well, thank you very much for that kind introduction. And thanks very much to everyone for inviting me here today. I'm really happy to join this group. I think it's an exciting group of people, and I love the format that you have here. So I think, as Sarah said, my journey was really quite straightforward. I started out with a very traditional academic ambition for my career in doing my PhD and my first postdoc in academia. And I wasn't really ready for starting my own lab. And so that sort of prompted me in the early 90s to think about a second postdoc position. And I was very keen and interested in learning more about how science is done in other countries. And so I decided to go far away and looked at a number of different places to do a second postdoc position in California. So I first off looked at many of the academic institutions, which I'm sure you're very familiar with: UC Berkeley, UCSF, UCLA, UCSC. And then right at the last minute before I was about to embark on my trip, my sort of interview tour for a second postdoc position, I was contacted by someone from Genentech who expressed interest in the type of research I was doing, which was IBD research. and asked if I would like to go and interview at Genentech for the postdoc program there. So I hadn't actually really heard very much about biotech at the time. This was the early 1990s, but the thing that Genentech did was offer to pay my airfare for that trip. So I thought, being a poor postdoc, this would be a really good way of actually offsetting some of the costs of my interview tour. So I hopped on the plane, started the interview process, turned up for my interview at Genentech, and was completely blown away by the campus, which is a very beautiful setting, but really, really blown away by the quality of scientists who were working at the Genentech campus, and specifically the ability that they had, or the creativity that they had, and the collaborative setup that they have to work in teams to try and address scientific problems. And it really sort of struck me as something quite different from my academic positions that I'd had as a PhD student, well, first an intern, then a PhD student, and then a postdoc. And so I ultimately decided to do a postdoc at Genentech. And I intended to be there for 3 years and then head back to the UK. It's very important, if you're looking for funding in England, to have a BTA, or a Been to America badge. And so I felt like I was on the right track of getting my BTA at Genentech, and then I would head back to continue my academic career back in the UK. But about a year in, there was a position that was advertised at Immunex in Seattle, and I hadn't actually been to Seattle, and I thought this would be a good sightseeing trip that I could go on. And so I arranged my interview very cleverly for a Friday so that I could spend a long weekend in Seattle, not really intending to get a proper job because I was quite enjoying being a postdoc. But I was struck again by the caliber of the scientists that were at Immunex, and ultimately ended up leaving my postdoc at Genentech early. And I moved to Immunex, and I kind of figured, well, I'll see out my 3 years at Immunex, at least earning, a little bit more money, and then I would head back to the UK. Well, as you can tell, I haven't actually made it back to the UK. So I've been in the States since 1994. I now married an American and delivered 2 American babies, or I suppose they're half English and a half American, but they were born in Seattle. And I've thoroughly enjoyed my journey here. So that early exposure to biotech really hooked me. And it really was this sort of team approach to solving scientific problems, and the ability to work with experts in other areas to actually think about making a drug that could make it all the way to the clinic. So the rest is history. After Immunex, we were acquired by Amgen. Sort of really learned at that company the ins and outs of true drug discovery and development. And then moved across the country to Biogen, where I headed up first off the immunology therapeutic area in the research group there, before overseeing all of drug discovery. And that's where I sort of topped out. I had a very big group. I had more than 300 people, and I felt that I was in a large company, and all I was doing was seeing PowerPoint presentations, and no one really thought I could actually do an experiment anymore. And so that prompted my decision to move from Biogen and to start a company as employee number 1, which is Pandion Therapeutics. And as you just heard, it was a rather fleeting journey. It was a lot of fun. I enjoyed it so much that when I'm finished with my 6 months at Merck, I'm going to be off and starting another company again very soon. So that's my journey, and happy to share any tips and strategies along the way, or answer any questions that any of you may have.
So we do not have any questions yet. So for those of you in the audience, as we move through this, please, again, feel free to drop questions into the Q&A. I do not believe you can drop comments into the chat. It is not open for the audience members, so please use the Q&A. As our first question, coming out of academia and moving into some smaller companies, and then obviously into a very large corporation, what are some of your tips or tricks or approaches for the leadership and team building and those dynamics that you saw differently maybe in academia or working with academics, as well as then small startup to a grown startup into a large corporation?
Yeah, I think that, it really comes down to the individuals. And I've always as I've gone around looking for different positions, different places to work, I've always really been drawn and attracted to groups where there was a lot of camaraderie and not infighting or competition. I think that the industry really is set up to enable and support that team approach to doing science. I think in academia, we're often very worried about being the first paper or the first person in our lab to actually do something, and ownership of ideas is absolutely critical, and is something that we all really focus on. But somehow in industry, there is also that desire to still be first to publish and still be the senior author or first author on a paper, or be the person who's giving the seminar or being a project team leader. But there's a lot of other things that are really fulfilling as well. And I think what I really learned about my transition from academia to industry is that it's important to wear different hats at different times of the day and different days of the week. So sometimes it is important to be the lead and to be the spokesperson and to be driving things. And sometimes it's important to put on a different hat and be a team member and support someone else in their role. And that's what I really have enjoyed about being in industry, is that being able to flip back and forth between leading something and supporting someone else who's leading something. And I think as I've looked at different places to go, I've really sought out individuals who support that notion. And I think, it's very difficult in industry to have people who are solo operators, because we are so dependent on each other to compete with the outside world rather than with each other in the same lab. So I don't really have any secrets, other than you can kind of tell when you're talking to people in the lab and lab heads or people who you'll be working with, what sort of approach they have. And if you're not really sure, do a little bit of digging and sort of figure out like what's a good collaborative person to work with. And I think that's true also when thinking about collaborations between labs. I'm sure everyone has got some war stories of good collaborations that have been or bad collaborations that haven't worked out because someone's walked off with the data or published it first. And then there's always some good collaborations as well, where it's been successful and it's a true melding of the minds and you've got some synergy. So it really is down to the people rather than the places.
Thank you. So thinking about that, you entered into industry early in your career, and I'm sure across your career you have worked with many different academics throughout through partnerships or collaborative agreements. We do have a question from, I hope I say this correctly, Rajiv. What is your perspective on mid-career academics potentially thinking about engaging with industry and pharma opportunities?
Yeah, so I think there's a lot of opportunities, and I think especially right now in the environment that we're in, where there's a much greater awareness of by the general public of scientific contributions. So I think in the old days, there used to be a little bit of bias of, if you're in academia, you viewed it as going over to the dark side to go into industry. And if you're in industry, you sort of viewed it as, well, these people who are from academia have no idea how to actually make a drug. But I think we've seen a real move in, I would say probably the last decade, where many of the large companies started out with the large companies making some key hires, either at mid-level positions or even actually at very senior positions, a lot of VP level research fellow positions that were opened up and groups created, because I think everyone realized there's many different ways to create a good scientific environment, and you want to have a mix of people, some of whom are innovative and creative and can feed that early engine, the pipeline, and then others who are much more focused on the execution. So, in terms of looking for opportunities, I whether you're entry level, whether you're mid-career or actually even senior career, a lot of this just comes from having conversations with people. Oftentimes those more senior transitions from academia to industry are not jobs that are advertised, but rather they sort of spawned from conversations that have happened at conferences, or from, giving a seminar, visiting seminar, and actually expressing interest in learning a little bit more. I think sabbaticals are also a great way to actually get exposure to what's going on in industry, and to actually see whether it's a good fit. And oftentimes that's what then creates a position. So I think we're seeing a lot more transitions from academia to industry, and we're also seeing some transitions from industry back to academia because of this real emphasis and focus on science. And then the funding situation right now for startup companies, there's a lot of investors around who are looking to support good ideas. I think many universities, and as we just heard in the introduction, there's a lot of universities who are really positioned to support spin out inventions from the academic institutions to startup companies. And that's another really great opportunity for thinking about how to bridge that gap between academia and industry.
Thank you. I hope that answered your question, Rajiv. So you mentioned going to conferences, making those sort of networking associations, and following up and networking with speakers who have been brought to campus, or in this case, brought to Zoom, offered through the campus. Are there particular industry-focused conferences that you would suggest to academics really interested in networking or getting a feel for what pharma is out there? Or do you feel that that's really still well done at the individual academic conferences, maybe for the Society of Chemistry or whatever it happens to be?
Yeah, I would say that most of the best connections are at academic conferences, because you've got the people who work in industry who are attending those conferences. A priori have a great interest in the science that's going on there. So that's a really good way to sort of see who's around, who's at the poster session, who's attending talks, even sort of scanning and setting up networking meetings, which even though we're all sick of Zoom right now, the virtual world has given us ways of very easily, instead of scanning through the printed names at the end of an abstract book, we now have ways where we can actually connect and have either virtual meetings or connect with people. So I think those academic conferences are the best places. There are occasional industry conferences that may prove to be useful if you are wanting to see what research companies are doing. I don't know that they're the best places to go to if you're looking to, see about potential jobs. So a good example of an industry conference where you can see who's doing what in your area of research might be one of the Cambridge Health Tech Institute conferences. So they're usually 2 or 3 days. There's often panels, usually primarily made up of industry presenters. But it's not the greatest, friendliest networking place, because everyone is, sharing their data, and it's not necessarily it's very unlikely to be the unpublished data. So I think you're much better off sparking those conversations at academic conferences. There are, in the immunology space, there are some hybrid conferences which actually have a pretty good mix of academic and industry participants. And one of those is the Information Research Association. So they do actually a very good job of putting together a hybrid meeting. And there may well be in other scientific disciplines, something like that. But I would say be yourself, be at the academic conferences, but sort of be on the lookout for who's asking questions, and try and go for a drink and have dinner and have coffee, sit next to someone at lunch.
So you have an extensive, while we're sort of on career building and waiting for people to put in additional questions, while we're on career building, you are a substantial force in women's leadership. You have served as the president of West in the Boston area, and been on multiple boards in that aspect. Looking at the attendees list, there are quite a few women researchers, scientists, PhD students, and postdocs on the call today. How do you have any special advice for how you build those relationships and how you maximize your career growth as a woman in a STEM discipline, and specifically science, bioscience?
Yeah, so I don't think there's any secret sauce, but it does take a little bit of effort, and so it really is important to build your network. And I'll be very specific in saying it's important to build your network, which isn't quite the same as networking. So many of us who are scientists are introverts. I am one of those individuals who derives no pleasure from going to a big poster session where everyone's milling around and you have to make small talk and pop from one person to the other. So networking in its a sort of base case is not something I find attractive. But I have found building a network is very important to hear about opportunities and actually to find a peer group who can give you advice around science, career, etc., and to find some people who are going to be sponsors or mentors. And so one very easy way of building a network is to join an organization, and it could be a scientific society and sort of volunteering on programming or helping put together the program. There's many different ways you can contribute to a science organization. Another is to join a women's organization. And so you mentioned WEST, which is Women in the Enterprise of Science and Technology. That's a very local Boston area group of individuals like myself who all volunteer for trying to create an environment where we empower that next generation of early to mid-career women to take control of their future by providing opportunities to network with each other, some educational opportunities and some mentoring opportunities. But there are many other programs. The national program is Women in Bio. I think there are chapters all around the US. That can be another really great way. And I wouldn't say just attend the meetings. If you really want to get the most out of it, actually volunteering or participating on a committee is a way to really forge deeper relationships with individuals and to really actually leverage that network that you're building. So as an introvert, as I mentioned, I hate going to networking events, but I'm okay going to a networking event if I have a job to do. So I make sure I keep myself very busy, whether it's passing out appetizers or pouring waters and wines. I give myself a job because building that network is really key. And I think especially as a woman in science, you want to share experiences and have a group of real close confidants that you can sort of share some of your experience with and learn how others have dealt with various situations. And there's power in numbers. So go power women warriors, go for it.
So I would recap out of all of that, except for the very last statement, for those of you in the audience who are not female, all of that still applies 100%. And that was very gender neutral difference between building your network and networking as well. So thank you for that, Jo. I want to switch gears just a little bit and ask you about Pandion. So you came out of big corporation, probably, I don't know, hundreds of projects that you were managing, if not thousands of different potential drug potentials, to found Pandion. And how did you manage building that company from the ground up? I think many of the academic researchers, mid-career academics on this call may be working in a space where they want to think about what it takes to do a startup, and that's a big ask.
Yeah, I think it's not as daunting as it appears at the outset. So I think you have to, number one, swallow your pride and be willing to go and ask for assistance from others. Number two, sort of build that network of other people who are in similar situations. So I was employee number one. We didn't have any founding science, so we didn't actually have anything other than a really high level idea around trying to develop therapeutics that could modulate the immune system locally in a tissue. That was the extent of our mission when the company formed. So I did spend my first 2 or 3 months really just sitting. I was squatting actually in a conference room of another startup company, just jotting down ideas, trying to think about some inventions that I could make. I filed a few provisional patents, but actually I spent a lot of the time calling people who I knew or asking people to refer me to others who are in a similar situation. So even things like, where do I find lab space? How do I buy equipment when I don't have any money? Is there lab space that I can, borrow a bench in someone else's place till I get some seed funding? Is there? How do I make an offer letter? I mean, even simple things like that. I'd come out of a large company where I wanted to make job offers, and I'd certainly made plenty in my time, but I'd never created a job offer myself. What sort of health insurance do I need? There were many, many things, and it started out with about a handful of about 4 or 5 people who had been in startup companies about a year or so longer than me, and one person who was starting a company at the same time. And it's amazing. If you start going out and asking people how they've done things, everyone is really, really willing to help out and provide advice. And I'm still friends now, and still having been through all the various fundraising activities, the IPO, and even now the acquisition, there's still people who I go to and ask, like, how did you deal with this? How did you deal with incoming interest? What should my response be? So that's really my advice here is, figure out who's been there a little bit before you and ask lots of questions, and don't be too proud to ask what you think may be dumb questions.
So we have another question from Emma, and it actually ties in fairly nicely to your career. How did you decide which career opportunities you wanted to pursue versus the ones you chose to pass on?
Yeah, that's a really, really good question, and it's always very personal. And now I'm in the position where a lot of people ask me which opportunities should they pursue. So I'm a big fan of making pro and con lists of the different opportunities and sort of weighing up what's a positive and what's a negative for each opportunity. But I think it really comes down to this. One is the science really solid, and are you convinced by the scientific strategy? So that's a no-brainer. I won't even have a conversation if I'm not in love with the science and the approach. And then the next is, what are the people like? And are these people who I'm really going to enjoy being around? It's not quite 24/7 because I do have a husband and kids at home, but it can feel a little bit like 24/7 when you're in a startup company. So are these people who I'm going to enjoy being around, or am I going to always feel a little bit like, oh, I have to, put on a show? Am I going to be able to be vulnerable with these people? So that's my second choice, is who is it I'm going to be working with? Are they collaborative? Are they going to be supportive? And am I going to be able to show up doing my best because I've got this really good support network around? So those are sort of, the first one's a no-brainer. The second one, it's hard when you're meeting people for the first time, but you generally get a good feel for the culture of a place where you're working. But the third tip that I'll give here is really thinking about, don't let ambition override your interests and your integrity. And the reason I throw that out is it can be very exciting to be offered something that's prestigious, either a title or a role or at an institution that's more prestigious than another institution. But at the end of the day, I think you need to go to a place where you're going to feel you can perform, 200% and be at your best. And it's hard because we all have egos. The reason we're all in this business and we're all doing PhDs or postdocs or have these really strong scientific careers is because we've wanted to strive and achieve. And it's a little bit hard to not let ego sort of pop up and get in the way and push you into making a choice that's maybe not quite right. And as I've looked at, my own career, I think I've always held true for not letting ambition get in the way, with the exception of one role. And actually, that was when I was at Biogen, and I was running the immunology therapeutic area. The company made a strategic decision to exit immunology and to focus on neurology. And I was a vice president of that therapeutic area. And I was offered a senior vice president role running the drug discovery organization. And that was the organization I had with 300 or so people. It was a very senior position. And my ego probably pushed me to take that role when I should have known I'm not a good core technology scientist. I'm much more of a therapeutic area strategist. So it wasn't my happiest year. So, but never look in the rearview mirror and start reversing. You always look in the rearview mirror and then think about the road ahead. And so that was what prompted me to think about trying something different and move into a startup. But that was sort of a good example of where I didn't think ego was getting the best of me. There were many reasons why I took that role. I felt I was helping out the company. My previous role had gone away. So it was very tempting, but I don't think it was the right choice for me.
I don't know that I know very many VPs who would say that the choice to be or to become a senior VP of a division, maybe upon reflection, was not the best choice for them. So that is something for all of you to take away. That's a pretty big learning experience. So bringing it back to academia a little bit, at least in terms of how across your career you have likely evaluated, as I mentioned before, thousands, if not hundreds of thousands of potential therapeutics, and I think there's likely a very big difference between how you make a decision and move forward in industry versus how you come across an idea as an academic and decide that there's something we don't know in the literature and we're going to solve this problem over here. How do you blend those, or do you have advice on blending those and maybe figuring out how to identify and solve problems that we can do so exceptionally well in academia that have a place in the market to entice a good exit for that idea and develop a product that'll save lives?
Yeah, so I think that the challenges are the same. There's always a problem to solve, but it might be that the type of problem is different. So one could be, what's the mechanistic basis of this observation, and is the best way to resource or to fund that idea through the grant mechanism? Is it writing NIH grants to support that avenue of research? If you don't get the NIH grants, that kind of tells you maybe it's not such an important thing, or maybe just no one else gets it. So that's sort of the mechanism, that's the feedback loop, I think, in academia for moving forward. And in industry, it's very similar. So it's not grants, but there are budgets and there are resources, including headcount, that are put on projects which are a good idea and removed from projects which are not a good idea. So it's a very similar feedback mechanism. I think people often view academia and industry as being quite different, but both involve requesting resource, money, people, and both require acquiring that resource in order to move the idea ahead. But I think what you're drilling down into is there a place where having got some funding and some resource, is there a place where it's better to do that research in academia? And are there some things where it's better to do that research in industry? And I think it is. And I think that's why we see so many academic industry collaborations. I can give you a good example of a collaboration which we're just wrapping up now to publish a paper. So we were very interested in looking at tethering some of our immune modulators in the pancreas for type 1 diabetes. We had a collaboration or some funding from the Type 1 Diabetes Fund, which is sort of an investment arm of the Juvenile Diabetes Research Fund, so JDRF. And they had given us some money and made some connections with an academic lab that actually ended up conducting the in vivo pharmacology studies and doing a very detailed analysis, because they were the experts in looking at the different cell types that we were modulating and what impact that had on the outcome of these diabetes-prone mice. Now, we made the molecules because we had that expertise. We didn't have any in-house expertise in diabetes. You know, could I have hired someone? Probably. It would have taken a long time to get these models set up. And I don't think we would have made the discoveries that we made because we were not experts and were not intimately involved in understanding the mechanism of diabetes. So I think that's a really good example where if you've got the ability in an academic lab to do mechanistic studies, whether it's in vitro or in vivo studies, really think about how that could facilitate getting to an answer quickly with an entity or a company or industry who have got molecules that could be tested in that way. And I think it was, you know, the collaboration, as I mentioned, was spectacular. We had regular meetings, we shared data, we really were very open in sharing all of the information. As I say, it's going to hopefully result in a nice publication in a few months.
So I'm hoping that many of the individuals on this call, because they've joined the call and it's really about innovation and entrepreneurship in academia and how do we build those relationships, do not view pharma as sort of, or industry as the big bad, and that the science that gets done in those collaborations gets done really well. And I don't know, have you seen sort of changes in the dynamics of that relationship and the collaborations with academia that maybe were not there as much in the late 90s, early 2000s, as you sort of came up through pharma and that antagonism that maybe everything that pharma does is about the final dollar and the big buck, and you know, the science is not as good.
Yeah, no, I think there has been a change, and I think, you know, I think it's fair to say there are still some companies who are not very willing to share information. So industry, there are some groups, even within a company that is more open to collaboration, there are even some groups that choose to not be open and share. But I do think the last couple of decades, we have seen more of a move where there is interest in basic research and basic science in industry. And it's not just setting up screens for small molecules where there isn't much innovation. There's entrepreneurship in how to advance something, but there wasn't much innovation in how to do new science. And I think we've seen a shift in that. And I think we're going to see even more of a shift over the next decade. We've got many more technologies and modalities now that involve understanding the biology at the outset. So the mRNA technologies, for example, gene therapy, these are not high throughput screens that, you know, you just run through until you find the best molecule. The molecule describes the biology. It's very related. And so I think we're going to see even more openness to that basic science collaboration between academia and industry as we progress in the next few years.
So Tamara has a question for you, building off of your concept about collaborating on molecules and some of the mechanistic discoveries. Where do you start to connect with pharma for those types of collaborations, either finding molecules that you can screen or groups that might have an interest in your abilities?
Yeah, so I think so there's a number of different ways to go about it. So one is if you have a technology or a molecule, I think the tech transfer offices at universities have become much more proficient at engaging and sort of outreach to industry. And I think that's a really good way to let industry know what's going on in an academic lab. So that's sort of the outreach version. I think that's probably still the best way. The tech transfer offices have a way of collating and presenting the information that's sort of, bite-sized for individuals in the industry side to understand and to actually ask for more data. And actually having a data package that highlights those strengths, either the techniques you have or the molecule that you have, also goes a long way should that conversation go further. So that's the outreach side. I would say if you are interested in someone who has a molecule, maybe you're searching the patent databases and you see a kinase inhibitor, for example, or an inflammasome inhibitor that is really of interest and you want to test it in your system, I think you can reach out directly to the individuals. I would, in that case, actually, target people who are the first or last, or actually any place authorship on that industry publication, and talk to the individuals. In that case, I would not recommend going through the traditional business development offices of industry, because it will just get stuck and lost. You need to make a scientist to scientist connection, and say, you've got a great model system, you're really interested in it. Do they have a molecule or a surrogate molecule that you could use to explore the biology? And I think that, most people are always interested in learning more about their pathways, and hopefully that would lead to, ongoing conversations and interactions.
Excellent. Tamara, I hope that gave you enough to go on there. I will say, all three of the campuses do have their own tech transfer unit. CSU Ventures is the tech transfer unit for Colorado State University. Venture Partners is the tech transfer unit for University of Colorado at Boulder. And if I get this right, I think it's CU Innovations at the Anschutz Medical Campus. And so Kathy, if I gave it the wrong name, please let me know. But each of us, we do have our own websites, and you can find us for those of you on the call. That is a great point that Jo made. You do have support, as you likely know from joining this webinar on the various campuses. So let's see, what else do I have? Were there any particular facilitators throughout your career that moved you? Well, you can pick out of this, Jo, that either moved you in one direction or the other, or experiences that you had that were surprising enough that they sort of shifted your course in how you decided what you wanted to do, or even maybe at the research level, really surprising scientific find that you weren't necessarily aiming for, and that moved an entire product or research line in a different way?
Yeah, actually, maybe I'll answer the last part of that question first about research and how I got moved in a different direction. So actually, earlier, I mentioned after leaving my postdoc at Genentech, I went to a company called Immunex, and they had a molecule that activated and expanded dendritic cells. And it was actually my ignorance around the science that made me test that molecule in a tolerance system. And I guess I hadn't quite appreciated at the time that this cell type was normally immunogenic as opposed to tolerogenic. But sometimes a little bit of ignorance can help, because I made some really interesting discoveries that actually then led to a whole body of work and the discovery of tolerogenic dendritic cells. So that was my my research experience of like, oh, whoops, that was a stupid experiment, but oh my gosh, didn't the data come out well? And aren't I lucky that I didn't overthink it? So I think that's sort of one piece of advice. Don't overthink things. Often we sit around planning experiments and we can talk ourselves out of doing the experiment because we know what the outcome will be. Well, sometimes you just don't know the outcome, and sometimes you just have to give it a go. So that's sort of a research example. I would say that in terms of surprising or direction changing events on the career side of things, we all experience sort of hiccups and road bumps in our careers, and I think that we can either sort of get caught in the downward spiral of getting flustered, being disillusioned, feeling that the world's against us, and why are people not seeing the benefits of our contributions. But I guess my advice there is, don't get flustered by setbacks. Actually start looking for the way out of that downward spiral so you can sort of pop up and look for a new opportunity. And there are definitely ways to sort of recreate yourself or recreate the direction and the surroundings if you go looking for it, especially during periods of change. And so, oftentimes, whether it's in academia or industry, things change. PIs come, PIs go, funding disappears and sort of requires you to do a pivot. And you can get really down about it. Or you could say, you know what? Okay, so I'm going to draw a line under that and I am going to move on to the next thing. And I'm not going to, I'm not going to have any regrets about it. I'm just going to jump in with both feet and look for that silver lining and find something new to do.
That is a really good point, given the last 18 months and the COVID pandemic. And for many individuals in academia, campuses were shut down, labs were closed. And I know at both CU and CSU, a number of faculty pivoted and took their area of expertise and approached the pandemic with it. And whether it was virus research or hand washing and wastewater treatment at CSU, monitoring the virus and wastewater, just a numerous, from a tech transfer standpoint, I will say things we would have never thought of because faculty were remarkably resilient and pivoted in that. So I think all of you on here can look to your own universities as well and see what Dr. Viney just said in action in your colleagues around you also. So I was thinking about as I move down this list, and those of you, we have about 13 minutes left. So if there are any additional questions, please make sure you put them in the chat. Along your way, what has sort of been your best practice in working with academic labs and pulling academics into your research groups, either to provide advice and expertise or use their services?
Yeah, I would say my most successful collaborations have been where we have really regular discussions. And so if I want to get a lot out of a collaboration, I often what used to be made sure that we visited face to face, but now it's set up lots of Zoom meetings. But actually, just like a lab meeting, and have a joint lab meeting, because that's how you really start sharing ideas and you start really revealing the data as it sort of comes off the press and getting new ideas for the next experiment. Oftentimes, I think, on either side, we feel that there has to be sort of a polished presentation or a polished data set to share. And I think that can get in the way of some real discoveries that can be made. And I also think by brainstorming together, two sets of brains or two sets of labs brains are better than one lab. And so it can sometimes feel a little bit of a drag and a bit stilted at the beginning when there isn't much data, but just sharing plans and sharing ideas. And these meetings can be very short, but every other week or at least every month, I think is the best way to make sure that the project stays on track. And as we all know, a lot of our experiments don't work. And so if you're having regular communications, you're real time providing updates as opposed to sort of the quarterly update where it's like, well, I tried this experiment and it didn't work, and and then you're not getting any input back. Industry also may forget to say, oh, we've got this newer reagent that may be better, or actually we can create some of this instead of you having to buy that material. We can actually make it in-house and share it. So I would just say, really think hard about the communications if you want a collaboration to be successful.
What is the best piece of advice that you have received maybe in two different sectors, sort of as a career versus in a startup functioning concept, and who provided that advice to you?
Oh, that's those are tough questions. So I think that the best career advice I've had is don't take yourself too seriously. And I think, especially when we're, on the treadmill and we've got 50 million things to do and we're always striving to do the next best thing, it can be easy to lose sight of that. And if you don't take yourself too seriously, you'll end up really being a better individual and a better contributor to the science that's going on around you. So that's sort of career advice. And then for the startup, the advice that I had from people who had gone sort of ahead of me was think carefully about how you build the team, because it's very when you're in a startup company, and I'm in Boston, and so finding talent is really competitive. And as in a startup, you can't pay salaries that are competitive, and you certainly don't have all of those fringe benefits like 401ks with matches and health insurance. You can't even get the same health insurance, even if you paid a fortune for it. You just can't even get the health insurance that big companies have when you're, a small company of less than 10 individuals. So you have to think about, building the team, and it can be tempting to just get a body in to help with the work. But that advice I was given early on is think hard before you hire anyone, because it's not a big company. You can't dilute out that person. That person's going to be front and center of everything that you do in a startup or in a lab setting, actually. And so think hard and make sure you bring in people with a variety of perspectives. So not just because I'm female, but I think a lot about diversity. And it's not just diversity in terms of sex or gender or race or ethnicity, but actually diversity of approaches, diversity of thought, diversity of decision making. I think that specifically is something that I was given the advice and I thought about it, and followed it, but I actually didn't realize how impactful it could be until I saw it in action. And so my first two hires at Pandion were quite different. It was a little bit painful trying to figure out a middle operating ground, because I had one individual who was a very fast decision maker and wrote very long emails describing why they'd made their decision. And I had another individual who was a 24-hour thinker and only read text. And if it had more than 3 lines in an email, they wouldn't read it. And so we had to have some discussions about, inbound communication and outbound communication. And inbound, you can ask for it to be in the style you prefer, and outbound, you have to do it in the style that the other person prefers. But it really made us a better team, because we actually then thought about how we were communicating. We already knew at the outset that we were not going to agree hands down without any discussion. And so I think we ended up making better decisions.
That is really interesting. That is almost a generational difference, according to how we really think about that now, and maybe that faculty and postdocs and students who are on this call very much differ in their communication styles as well. So that is my food for thought leaving this conversation today. But
yeah, and one other tip I'll give is, I think we should all be much more upfront about what style of communication we like, rather than being frustrated by it. So, whenever I start working with people, I give people the heads up. I'm a 3 bullet point max person. And if you write me a long email, it will sit in my inbox until I sit down and have time to read it, which might be a few weeks. So if you want my attention, give it to me in 3 bullet points. And that works. And, sometimes, and people get used to like, oh, if I want to do inbound into Jo, that's how I've got to do it. The other individual I talked about, I need to, I have to sit down and write a long email and all the background and the here's the why and the what and the alternatives. And so I then have to, go out of my way to communicate with that individual. But I think we should all be upfront about how we like to be communicated with. That's what my kids tell me when they send me texts with emojis that I have no idea what they mean.
So we only have a couple more minutes, but I want to leave the audience with sort of this last concept about the challenges of walking away from a tech or an invention or an idea that you are just absolutely passionate about, but it's just not viable. Like how do you walk away from that and move on to your next big thing?
Yeah, it's the perennial problem of that program that will never go away. So I think it's very hard to stop a program. And so I never stop a program, but I do put it on the shelf. And that is a lot easier to do, to put something on the shelf until someone else has made a discovery or you make a discovery that enables you to get that program off the shelf again. And it's a way to very easily stop resources without feeling the pain of loss. And so I think that is really important. I also think it's important to like buy a big old cake and have a bit of a celebration and say goodbye to that program. And, you know, in science, we do often come back to things 2 years later, 5 years later, often 10 years later. And so that's why you never want to bury it underground. You just want to put it up high on a shelf so that you're not tempted to pull it down and use it every day. So it's a bit of a mental trick to enable you to move on without the heartbreak.
So do you have any final parting words or advice to academics and or researchers that are really considering doing a startup? Or
yeah, so I would say follow your passion. It's a lot of fun, and don't get frustrated, and enjoy the journey.
So that's it. It's 12:57, and I know everybody in the world of Zoom would like a couple minutes before their next meeting. So I want to thank everybody today for coming to the Ask the Expert seminar, and thank you, Dr. Viney, for joining us tremendously. Dr. Viney did mention at the very beginning on how to build a network versus just networking, and one of the greatest shorthand places for you to do that is on LinkedIn, where I do know that Dr. Viney has her own profile. So if anybody would as long as Dr. Viney is okay with it, I'm sure you can find her. I will give you a tip that I personally don't accept invitations and connections unless somebody tells me why. So you might want to add a note if you do ask her to connect with you as from the Ask the Expert, so she has some rationale for why you're reaching out. But or your favorite immunotherapeutic module, you know, whatever it happens to be, molecule or discipline. But thank you all, and thank you, Dr. Viney, and that is it for this month's installment. So
thank you, and good luck, everyone.
Thank you. Bye.